Okay, so next we're going to do an overall inspection of your back. I again would do this without a shirt being on. First, I would just inspect to make sure there weren't any obvious lesions or deformities. I would palpate any tenderness. I would palpate down his spinal column to notice any vertebral tenderness or bulging of any discs. The paravertebral muscles for any tenderness. I'm going to test for any CBA tenderness, any tenderness here, which if there were tenderness, it may indicate a kidney infection. So next I'm going to have you stand up. Okay, so again, I'm going to note any asymmetry, any obvious deformities. I'm going to have you bend as far down forward as you can. And the spine is noted to be midline. Stand up. Okay, I'm going to have you bend backwards. Okay, good, and up. And then to the left side, and to the right side. Very good, and he was able to do that all symmetrically without any difficulty. And you can sit back down. Next, I'm going to listen to his posterior lung fields, and again, I would do this. First, I'm going to percuss his posterior lung fields, and again, I would do this with his shirt being off. So I'm going to use the middle finger of my non-dominant hand and tap it with the middle finger of my dominant hand. In the intervertebral spaces. And I would do that side to side in a ladder motion to assess for symmetry. And I would do that in these 7 areas. And what should be heard is resonance in all those areas. And then I would take my stethoscope and I would auscultate for any adventitious breath sounds. And again, I would do this without the shirt being on. Deep breath into your mouth and out. Again. And again. And one more. Okay. And the only thing I did forget was to test for the respiratory expansion to make sure it's symmetrical. So I would put my hand on his back and I would have him take a deep breath. And both of my hands did go out equally as he took his deep breath. Okay, so next I would inspect his anterior chest, and again I would be noting for any asymmetry, any obvious deformities, lesions. I would note any obvious respiratory distress. I would again palpate for any tenderness. I would also do that on the back. I didn't mention that, but I would palpate for any tenderness, any crepitus noted. There's no crepitus noted. And again, I would percuss and 6 areas on the front in the intercostal spaces. Noting for resonance, and I would do that in these 6 intercostal spaces. And again, this would be done, on direct skin. Next, I would check for respiratory expansion again. Take a deep breath in. And my hands move symmetrically with his inhalation and exhalation. I would listen for any adventitious breath sounds again in all 6 areas on the front, moving in a ladder and checking for symmetrical breath sounds. Okay, and again, I would be doing that on his skin to have the best sounds. And if any adventitious breath sounds were noted, we can do the bronchoscopy. We could test for fremitus, which would be placing our hands in the intercostal spaces and having him say 99, and the vibration should be transmitted through that. Or we can do the agaphony test, where I would have him say E, 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 and auscultate in various areas. If a muffled E sound was what was transmitted, that would be normal. A long A would mean a consolidation like pneumonia. Okay, so next we're going to move on to the cardiac exam, and the very first thing we're going to do is assess jugular venous pressure. So what I'm going to do is I'm going to look for the jugular vein and look for the highest point of impulse, which is about right here, and then I'm going to assign sternum and place my rope right here. And he's measuring about 2 centimeters, so we would add 5 to the center of the atrium, which would give him a jugular venous pressure of about 7, which is normal. Okay, so next we are going to assess his heart function, and again, this would be done without his shirt on. First, I would inspect his skin, again, for any deformities or lesions, and then I would palpate along the second intercostal on the right side, the left side, the third, fourth, fifth, and then the 5th intercostal midline, noting any pulses, any thrills, keys, and then I would take a listen with my diaphragm first. I would start with the second intercostal on the right, which is where the aortic is, and then I would go to the second intercostal on the left, which is where the pulmonic is. Down to the tricuspid, Erb's point, and then the apex or the mitral, which is also the PMI. I would be noting S1 near the apex and S2 near the base. Okay, so again, for the heart, I would be listening to S2 at the base and S1 at the apex. I would be listening for any sounds of S3 or S4. I would be listening for any murmurs. And then I'm going to listen to all those areas again with the bell. Again, the second intercostal on the right, the left, the third intercostal, fourth, fifth, and midline, fifth intercostal. Okay, so next I'm going to have him sit up, and I'm going to take a listen one more time with the bell, as sometimes when you're sitting up leaning forward, you might catch a little bit of mitral stenosis or some S3 or S4 sounds, or your insufficiency a little bit easier. So lean forward a bit. And again, I would be doing that directly on his skin. So next I'm going to have him lay back down, and we're going to do a general inspection of his abdomen. First, and again, this would be directly on skin, I would note any peristalsis, any waves, any ascites, any lesions. Next, I would auscultate in all 4 quadrants. That would be the right lower quadrant, the right upper quadrant, left upper quadrant, left. And his bowel sounds are regular. I would note if they were hypoactive or hyperactive. Okay, so next I would take a listen to his abdominal aorta. And his renal arteries, his iliac arteries, and then I would take a listen in the groin for the femoral arteries, and I would also palpate the femoral lymph nodes. Okay. So next I would percuss the liver borders. I would start around the umbilicus and note resonance, pudalmus, or I'm sorry, tympany, which would be the bowels, pudalmus, which would be the base of the border margin, the liver margin, and then I would start around the intercostals and test for resonance pudalmus, and the liver border should be about 4 to 7 centimeters, and then I can do that on the left side as well to see if I can detect the splenic borders. Next, I would do some light palpation, noting for any obvious masses, any tenderness. And then I would do a more deep palpation, put one hand behind him, and then press up and under his rib cage, looking for any nodules or liver enlargement, and then I can do that on the other side and check for the spleen as well. We're going to palpate the aorta right above the umbilicus, and it should be about 3 centimeters. So next we're going to inspect the male breast area, inspect for any asymmetry, any discharge from the nipples, any obvious deformities or lesions, and then we're going to palpate for any masses or tender areas.